Good morning. It's 9 o'clock, and in the interest of respecting your time, I would like to go ahead and get this thing started. I expect that as we go along, we'll have some more folks trickling in, and that's okay. They can just pick up where they come in. So with that being said, I would like to ask Dr. Giovanna Merriman to start us off. Dr. Merriman, are you here?
Yes, I am. Good morning. Good morning, everyone. It is such a pleasure to see so many folks' cameras on and to be able to see faces this morning. I would ask that if you do have the ability to turn your camera on, please do so. It just makes everything more interactive in this virtual world. My name is Giovanna Merriman. I am the Associate Director for Family Health Services here at Tarrant County Public Health. I bring you greetings and welcome you to this meeting this morning on behalf of Tarrant County Public Health. Our Director, Vinny Tanasia, was unable to be here this morning. And so we are just excited that all of you all have taken a step to engage with us as we continue to look at ways to reduce health disparities here in Tarrant County, especially those that have been exacerbated by COVID-19. So thank you all for your efforts and attending this morning.
Lauren, you're on mute.
Thanks, Dr. Wingate. Thank you, Dr. Merriman, and thanks to all of you for coming. I recognize that this was a very short turnaround, and after speaking personally with some of you, I know that you all have made an effort to be here this morning, and we really appreciate that. I'd like to ask all of you to add your name, position, and the organization that you are with in the chat, please. As we go along this morning, when you have a moment, please take a minute to check out who is here and take note of who is not here. If you know someone that is already doing this work in Tarrant County or someone that has expressed interest in getting involved, please keep them in mind and provide their contact information during follow-up so that we can reach out to them. At this time, I'd like to introduce you to our health equity team. I am Lauren Donnell, Health Equity Supervisor, and I work under the direction of Dr. Yvette Wingate, Health Equity Coordinator. And I also oversee a team of 5 health equity specialists. They are Tanisha Stanford, Barbara Young, Tanya Teal, Kylie Brooks, and Nikos Elzy.
You're on mute again, Lauren.
Sorry about that. A few quick housekeeping items. If you aren't familiar with GoToMeetings, I'd like to draw your attention to a few features. The chat bubble is at the top right corner of your screen to the right of the participant list. And you may chat with everyone or with individuals by clicking the drop-down arrow at the bottom of the chat window. If you need assistance, Kylie Brooks will be manning the chat window and she should be able to respond accordingly. Along the bottom of your screen, you'll see a camera and a microphone. We ask that you please mute yourselves when you're not speaking. And if you choose to utilize your camera, Nikos will be keeping an eye on the feeds. So feel free to just raise your hand or give a little wave if you need to get our attention. There will be times throughout the meeting where we ask you all to contribute to some brief rounds of discussion. And during those times, please feel free to put your thoughts and comments in the chat or come off of mute and speak freely. It should go without saying that some of the things we discuss throughout the course of our time together will be sensitive in nature. We ask that everyone show respect and empathy at all times and that you keep those sensitive things here. We cannot make progress without being courageous in our sharing. So I'd like to provide a platform where you all feel free to do that. And of course, we will be wrapping up the meeting with some additional time for questions. So you all know what to expect. We'll start by reviewing a few key items related to equity, and then a brief overview of some data. And we'll touch on the sectors that were identified through internal processes and ask your thoughts on any additional areas that you believe should be addressed through this plan. We'll talk about the purpose for the plan and the work involved, and then Dr. Wingate will close us out with an outline of our next steps together. We know that some of you are short on time today, and you had to move some things around to fit this meeting into your schedule. We appreciate that. So these next couple of slides are just for you. You're here because we need you. And these things that we're asking you for, your time, which we know is valuable, your expertise and your knowledge, your ideas, your abilities to amplify the voices of your communities and speak on their behalf, as well as your ability to take this work back to them and garner their suggestions and critiques are vital. Most of all, we are asking you for your commitment. We need to know that you're prepared to commit to this work through your actions and through your participation. How does this work benefit you? A plan that other community agencies and organizations can utilize to advance racial and health equity across Tarrant County and beyond. This work is unique because it won't just be another talking point. It has built-in parameters. We will be working along a pre-established timeline, and this will not stop at the creation of a plan that just sits on a shelf and gathers dust. We will spend several months developing the plan and gathering input and feedback from impacted community members and important stakeholders across the county. Then we're going to enter into an implementation phase where we'll begin working the plan, changing policies and practices across your organizations and our own. Lastly, we will evaluate our efforts together so that we can identify areas that need additional change to accommodate our goal of long-standing sustainability and accountability. It is a daunting challenge, but please know that we will be providing help along the way. Our health equity specialists will provide opportunities for free trainings for yourselves, your staff, and clients if needed. And they will also provide assistance with policy review, development, and implementation. We know going into this that we are not the first, and that gives us an advantage because we're able to build on the success of others. In particular, Seattle King County has made a commitment to prioritizing racial equity in their work across the county. King County, Washington established Ordinance 1648 10 years ago. The ordinance was developed to work on equity and social justice from an initiative to an integrated effort that applied their 2010 to 2014 countywide strategic plans principle of fair and just intentionality in all the county does in order to achieve equitable opportunities for all people and communities. Define determinants of equity as the social, economic, geographic, political, and physical environmental conditions in which people in the county are born, grow, live, work, and age that lead to the creation of a fair and just society. Access to the determinants of equity is necessary to have equity for all people, regardless of race, class, gender, or language spoken. King County focuses on equity impacts on communities of color, low-income populations, and limited English-speaking residents. This plan provides excellent goals, objectives, and strategies that can be modified for any city or county government. We also have roadmaps to build on through more localized planning. Some of you may be familiar with the Arlington Unity Council and the work they have done to establish short, medium, and long-term recommendations for change in their community. At this time, the City of Dallas Equity Division has also been working hard to identify equity indicators so that they can begin to implement changes to policies and procedures to allow their city to become more inclusive of their resident needs. Here, the City of Fort Worth Diversity and Inclusion Department convened a task force on race and culture to address the disparities faced by our minority communities and plan for change. Braver Together and United Way of Tarrant County are working together to address racial equity in the 76104 zip code. We know that some of you are here representing other organizations, both community-led and more higher level. They're also doing work in these areas, and we welcome you as we move along to share your experiences and the barriers that you have faced while implementing your own planning. We have also invited representatives from these entities to participate with us, lending their experience and expertise as we build a plan to incorporate their work into ours. We have no desire to reinvent the wheel here, but rather to team up and build a strong coalition that allows us to work side by side so that we can accomplish our goals together. At this time, we invite you all to put your comments in the chat or to unmute and share what issues that you've seen or experienced during the COVID-19 pandemic that you would like to address through this work. Monica, I see you there in the chat with lack of access to technology and the internet. That is definitely a huge, huge, huge issue. Improved access to healthy food. Thank you, Matt. Increased social isolation. Absolutely, Laura. Lack of access to the internet. Again, yes, Shelley, that's a big one. That's a big one. I think as a parent, we've seen it with our children, and during that time when we were working from home and our kids were doing school from home, and it's everybody's trying to pull off the internet at one time, and it gets a little crazy. Maggie, we're all in the same storm, but not all in the same boat. Had different access, different needs, and different experiences. Absolutely. And that's really important to recognize. Linda, clearly the rapid escalation of the pandemic left no time for planning how to respond, and everyone was working as well as they knew how to work. Absolutely. Absolutely. We lacked testing sites that were convenient to low-income neighborhoods. When new sites were added, they tended to not be in the heart of the most disadvantaged neighborhoods, but on the periphery. Little to no preparations made for testing of homebound people, vaccine distribution, also more difficult for folks that were not test savvy. People being elected officials that were mainly white, so not reflective of the communities that we're trying to reach. Very important. Yes, yes. Pat Bailey in the chat. Programs were lacking for our aging senior markets and caregivers. Absolutely. And we know that that was a really, really, really impacted demographic. Support for adolescent mental health. Definitely, definitely. And it's difficult to get those appointments now too. Mental health is in high demand. Misinformation from Donna. Woo, that's a big one. Attacks on voting rights, staffing issues for health systems and in-home care providers. Monica, elected officials, period, who didn't bother to fully understand the response process. I think that's something that we've all noticed, is how politicized this public health issue has become. Definitely a real problem. Thank you guys for contributing that. It's important. Y'all can feel free to keep sharing. I'm going to go ahead and move us on along, but y'all keep going. I want to quickly touch on some key terms. I know that a lot of you that are gathered here today are familiar with these terms, but I'd be remiss if we didn't touch on it a little bit. So health equity, this is achieving the highest level of health for all people, regardless of differences in social, economic, or environmental conditions. This picture is a good example. We see a variety of people, you know, it looks like we've got some children. It looks like we've got, you know, this woman in the wheelchair. We've got people with ladders. We've got tall people that are able to reach up on their own. We've got folks that are helping people. And they're all able to get the apples, you know, they're all working together to get the same apples so that they can eat. Health equity focuses on the different determinants that can affect an individual's health overall. And advancing health equity seeks to decrease and eliminate health disparities, which are the health differences that adversely affect groups of people who have systematically experienced greater obstacles to health based on their racial or ethnic group, religion, socioeconomic status, gender, age, mental health, cognitive, sensory, or physical ability, sexual orientation or gender identity, geographic location, or other characteristics historically linked to discrimination or exclusion. Thus, health equity means social justice and health. An example, you know, no one is denied the possibility to be healthy for belonging to a group that has historically been economically and socially disadvantaged. How many people have seen this image? I know that I've seen it, but there's something that's a little different here with the first scene and the last one. So the first one, this is reality. One person gets exceedingly more than is needed, while the other gets exceedingly less, and thus a huge disparity is created. The next image, equality, the assumption that everyone benefits from the same supports. And this is considered to be equal treatment. In the next scene, we have equity, where everyone gets the support they need. So that produces equity. They can all see over the fence now, everyone's happy, everyone's cheering. But then the last scene is empowerment. So everyone can see the game and there's no need for supports or accommodations because the root cause of the inequity was removed. The systemic barrier is gone. Thousands of research studies have shown that in much the same way that a tree is impacted by its soil, a person's health is impacted by their social, political, physical, and economic environments. When people have access to thriving communities with quality housing, transportation, education, food systems, employment, and healthcare, they have better health outcomes. Individual behavior choices do impact health, but research shows that improving root causes is much more effective than attempting to influence individual behaviors. Social inequities are seen as the root causes of health inequities, which are the differences or disparity in health outcomes that are unjust and avoidable, according to the Center for Disease Control and Prevention. Shown in this slide are roots that represent examples of social inequities, also known as social determinants of health. Social inequities must be addressed in order to work toward health equity. And health inequity limits people's ability to gain access to resources and experiences required for health and well-being. When people lack access to decision-making that affects their work life and living conditions, their health suffers. And to reduce health inequities among the disadvantaged, vulnerable, impoverished, and marginalized, we need to create supportive policies and practices that foster healthy environments. This slide, published by Seattle King County, reinforces the notion that the unhealthy stream creates these inequities. So policies, practices, and systems that have been put into place that contribute to inequities lead to conditions and outcomes that have historically tended to treat poor and individual family levels and have incarceration, obesity, homelessness, health problems, untreated mental illness, low birth weight, unemployed, underemployed folks. Whereas the healthy stream, where we focus on getting these practices, policies, procedures into place from the beginning, result in conditions and outcomes that allow people to thrive in their environment. So what about racial equity? This is the process of eliminating racial disparities that actually improve outcomes for everyone. I think we've all heard that saying, that a rising tide raises all boats. So they must be intentional. They must be continuous. It's not something that we can look at in one point in time, make a change, and think that's it. I think that in the past, that's what's happened. People see one thing, they say, oh, we fixed it, it's good enough, and they leave it alone, and it's not enough. It has to keep going. It has to be a continuous, evolving practice. Just like back when the civil rights movement started, changes were made, things were happening, but here we are sitting in 2022, and we're having these same conversations because the work is not done. It's not complete. We're still seeing these disparities. So we need to change our policies. We need to change our practices. We need to change our systems, and we need to change these structural barriers so that we can produce measurable change. What you're looking at on your screen now is from the CDC's Social Vulnerability Index. So the Social Vulnerability Index utilizes census data, and it helps public health officials and emergency response planners meet the needs of socially vulnerable populations in emergency response and recovery efforts. Social vulnerability refers to the potential negative effects on communities caused by external stresses on human health. So here you see Tarrant County, and they are mapped out from the highest vulnerabilities in the dark colors all the way down to the least vulnerable areas in the lighter colors. And this is split out by household composition, socioeconomic status, race, ethnicity, and spoken language, as well as housing type and transportation. On this next side, we see overall social vulnerability. So they take those factors and they create this that shows us our most vulnerable areas all the way down to our least vulnerable areas by combining those factors into one map. This helps us address natural and man-made disaster relief so that we can target those areas that we know are most vulnerable and most likely to be impacted in these situations, like we're in now with the pandemic. So another brief discussion point: how should we address disparities in Tarrant County that do not depend on individual changes in behaviors? Because that's what we're here to do. We're not going to focus on individuals. We're going to focus on these systems and policies and practices that we have in place. And in addition, how do we create change and reduce disparities? So I'm going to ask you guys again to just share some thoughts in the chat, or if you would like, you're welcome to unmute yourselves and speak. Maggie, I see that you said sharing information in a wide variety of ways, connecting with people in the place. Connecting with the people in the place. Yes, yes. I do think that connecting people and sharing information is a big part of it. Charles, educating legislative representatives. And then Brenda following that with education and advocacy. Absolutely. We can do what we can here locally, but we know that when we keep looking towards bigger levels and impacting that change, a lot of it comes down to legislative policies, practices. Alfonso, ensure that resources related to primary care, whoops, y'all are moving me fast, related to primary care are easily available and affordable throughout the county. Definitely, definitely. If people can't access it, if people can't afford it, then it's not going to happen. Linda, taking services into the neighborhoods and homes of people who have a hard time getting to them. And that builds on your previous point about testing and vaccinations and getting them targeted to these areas, going into these areas where they need that. Community-based for people with transportation challenges, off hours for people whose work schedule is inflexible, definitely. For those of us that are working, for these people that are just trying to survive and get by day to day and picking up work where they can't always make it to a doctor's office or to supportive services between 8 to 5. They need to be able to access those things outside of their normal work hours. Recognizing that there will be another pandemic or public health crisis that requires a rapid response and coming up with plans now for how to scale up and address. And that's what we're doing. That's exactly what we're here to do. So that the next time this happens, because we know it will, we don't know when, but we know that it will, there will be plans in place so that we don't see these delays, we don't see these gaps, we don't see these disparities. And advocacy around local policy pertaining to the environment that's built. Definitely. Thank you guys for sharing. So that brings us to this slide, the Centers for Disease Control and Prevention, the CDC. They came up with a national initiative to address COVID-19 health disparities. So that's the purpose. We are here to address these related health disparities, and we want to advance health equity. These efforts will be focused on high risk and underserved residents of Tarrant County, which look a lot like our racial and ethnic minority populations. And these efforts are also focused towards rural communities, but for us, we're not looking at rural communities. That would be through the work of some of the other organizations that are receiving this funding. Our logic model outlines 4 strategies under this initiative. There are other folks in Tarrant County that are also working to address some of these strategies, but I'd like to draw your attention to strategy 3, to build, leverage, and expand infrastructure support through health equity training, developing an inclusive workforce, organizational infrastructure and planning, and health equity staffing. And through doing these things, we hope to improve state and local health departments and community capacity and services to prevent and control COVID-19 infection or transmission, and improve and increase testing and contact tracing with the goal of reducing COVID-19 related health disparities. Through this work, we will also be advancing racial equity and health equity in Tarrant County, hopefully for years to come. So how will our work contribute to those goals? Strategy 3 tells us that we want to establish, enhance, or implement work groups, task forces, and positions to guide addressing COVID-19 among communities at higher risk that are underserved. We want to convene and facilitate multi-sector coalitions or advisory groups like this one that will include members of underserved communities and organizations that serve those communities. So that's why you all were selected. You are members of underserved communities. You are members of organizations and groups and coalitions that are working hard to serve these communities already. And we're asking that you provide advice, guidance, and recommendations for addressing COVID-19 and advancing health equity in those communities. We're also going to update jurisdictional COVID-19 plans and health equity plans so that we can support communities that are most at risk for COVID-19 with the intention of setting up systems that put in place infrastructure and planning that can support future emergency responses. So let's take a look at some data. On this slide, you'll see COVID-19 information from our Tarrant County COVID-19 dashboards, and we're looking at the 76104 zip code. So what do we know about 76104? Almost 18,000 people reside in that area. And in Tarrant County, it is one of our highest ranking on the Social Vulnerability Index. It has a much lower average life expectancy, and it is 45% Hispanic and 36% Black. And if you'll note, total cases of COVID-19, 5,616, and total number of deaths, 108. That shows us that they have a death rate per 100,000 of 589. And let's contrast that with what we see here. On this slide, we see the same information for COVID-19 for the 76022 zip code. What do we know about 76022? More people live there. So approximately 24,000 people reside in the area. That's around 6,000 more people than live in 76104. In Tarrant County, it is one of our lowest ranked on the Social Vulnerability Index. It has a much higher than average life expectancy, and it also just so happens to be predominantly white. Whites make up 60% of the total, compared with 76104, where whites only make up 16% of the population. The rest of 76022 is only 19% Hispanic and 13% Black. At the same time, we see the total cases of COVID-19 and total number of deaths and the death rate lower than what we see in 76104. You can compare total cases of COVID-19 at 3,501 versus that 5,616 that we saw in 76104. Total number of deaths, 44 for 76022 versus the 108 that we saw in 76104. And then with the death rate per 100,000, 326 versus 589. I don't want to just doom and gloom you guys to death. Due to the hard work of many people and organizations across Tarrant County, and many of you are here today, efforts to get residents vaccinated are coming along. In 76104, over 50% of residents have had at least 2 doses of the vaccine. Maggie, I saw that, the doom and gloom is important, and it is. Over 50% of residents in 76104 have had at least 2 doses of the vaccine, with a vaccination rate of 56.4%. And in 76022, over 50% of those residents have also had at least 2 doses of the vaccine, with a vaccination rate of 56.7%. So only slightly higher rates there. This is good news, and it means that inroads are being made to protect our most vulnerable people. But as you can also see on these maps, we are far from finished with our efforts, and many areas represented by the lighter shades of blue are still in need of focused efforts to decrease incidence of COVID-19 and to increase vaccination rates to prevent deaths and serious illness. For example, right next door to 76104 is 76105. They have very similar population profiles, and their vaccination rate has not yet reached 50%. There is still much work to do. In addition to public health, partners across Tarrant County have been compiling data throughout the pandemic, pulling from federal and state sources in conjunction with local efforts like community needs assessments. 4 sectors were identified as high priority: transportation, communication, housing, and health. We know that we need to take steps to increase availability, access, and awareness of housing, transportation, and healthcare. Communication must be refined to incorporate clear and consistent messaging to combat myths and distrust of valid and critical information. According to the most recent update to the Access North Texas Regional Public Transportation Coordination Plan, issues predating the pandemic include the length of time it takes to get from location to location using public transportation, the unavailability of public transportation in different areas of Tarrant County, and the unavailability of drivers when utilizing rideshare programs. The North Central Texas Council of Governments plans to release its latest update to this plan this spring, and it will include progress toward goals and strategies that they are working toward to address some of the aforementioned system deficiencies. When we think specifically about COVID-19 and its impact on transportation, research published in the Journal of Transportation Research Board informs that transit riders are more focused than ever on improving their local systems. It has been found that the pandemic only exacerbated pre-existing problems. Where previously complaints about the untimeliness of public transit and lack of availability had been noted, COVID has attributed to a greater shortage of available drivers and riders, which has only increased wait times and the number of available routes. Riders have also expressed concerns about transportation entities protecting the health and safety of their workers, while also providing safer options for themselves as riders. They overwhelmingly support strategies intended to incorporate means of social distancing and cleanliness within public buses, trains, and automobiles. Many riders also reported increased fares and worried about the economic impact of the pandemic on public transportation organizations. We know that prior to the pandemic, there were some commonly noted issues with communication. There's a digital divide between those of us that grew up without the internet and accompanying devices and those that have. In addition, the digital divide is widened by those that have access to the internet and devices and those who do not. Education level, income, and race ethnicity all influence the divide. According to a research initiative from Harvard in 2021, nearly half of Americans without at-home internet were in Black and Hispanic households, and digital divisions were likely to keep historic disadvantages in place in the future. While 1/3 of white workers were able to work from home back in 2018, less than 20% of Black workers and only 16% of Hispanic workers were in jobs that could be performed remotely. Written methods of communication are hampered by literacy levels. The National Center for Education Statistics shows us that Texas is at the 4th lowest literacy level in the country, with 19% of our adults lacking basic prose literacy skills. We also know that cultural awareness is important when communicating with different populations. Materials should be broadcast in native languages. Spoken messaging should be delivered by visually reflective speakers, and language should be culturally sensitive with respect to the differences in the way we approach and interact with various communities. COVID brought those issues and more to the forefront. Our reliance on technology has only increased. We've seen efforts to get laptops and hotspots to quarantine school children. And as many of you have experienced and may be practicing right now, the concept of working remotely has been cracked open and found to be sustainable in ways that we had not previously considered. We have seen a rise in the use of social media to distribute information. A Pew Research study in 2021 reported that over half of all Americans report a preference to accessing news information on digital platforms, compared to 35% preferring television, 7% preferring radio, and 5% preferring print publications. 53% of those surveyed reported that they had accessed news through social media outlets. Not surprisingly, those numbers only went up according to the age of the respondents. Knowing that younger generations are more likely to reference social media as a news source means that issues around communication and digital distribution of information will only increase with time. The overabundance of information predating the pandemic has led to what the World Health Organization refers to as an infodemic. Misinformation and myths flood the internet and make it difficult for people to discern fact from fiction. When planning for the next emergency, we must consider how we can communicate in a way that conveys clear, consistent, and factual information from trusted community partners and experts in the medical and public health fields. In 2018, a community needs assessment was conducted through the Community Action Partners Program, and it was observed that affordable housing was one of the top 3 identified needs. Housing programs have wait lists, and some of those waits are measured in years, not months, and certainly not days. Respondents also noted that oftentimes subsidized housing is located in areas with high crime, making it more difficult for families to access affordable housing opportunities that also make them feel safe. The Tarrant County Homeless Coalition informs us that the Black community is disproportionately affected by homelessness. In 2019, although the Black population only comprised 15% of the overall population of Tarrant County, they made up 59% of our homeless population. The Urban Institute's Housing Finance Policy Center asserts that the gap in home ownership by race is bigger today than it was when it was legal to refuse to sell or provide a loan for a home to someone based on the color of their skin, from a reported 27-point gap in 1960 to a 31.3-point gap in 2021. With COVID-19, we did see one good thing: a 30% decrease in homelessness due to an influx of federal funding to a variety of housing programs and a moratorium on evictions. However, we have also seen a steady rise in home and rent prices and housing supply, which has not been able to keep up with the demand. According to the Census Bureau, 13% of households experience a severe housing cost burden, spending over 50% of their income on housing. Alongside the eviction moratorium, we also saw rent relief and assistance coming from local and state resources. Among them, the Texas Rent Relief Program, which encompassed $1 billion in funds, the City of Fort Worth Emergency Rental Assistance Program, which covered up to 12 months of assistance with rent and utility payments, and the Tarrant County Emergency Rental Assistance Program, which was earmarked for people living in Tarrant County but outside the cities of Fort Worth and Arlington. And both the city and the county in those cases were local distributors of federal funds. According to the 2020 County Health Rankings by the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute, Tarrant County was in the top quartile of healthy outcome counties in Texas when compared with 244 other counties. According to the CDC, the top causes of death for Tarrant County residents in 2018 were heart disease, cancer, and accidents. We know that heart disease disproportionately affects the Black community. 188 men out of 100,000, compared with 165 for whites, 91 for Hispanics, and 81 out of 100,000 for Asians. For cancer, we see a similar pattern. For every 100,000 people, 165 Black people die of cancer, while their white, Hispanic, and Asian counterparts are less impacted. Only with accidents do we see a slight change. with whites matching blacks at 39 people of every 100,000 dying of accidental death. In Tarrant County, we have seen over 547,000 cases of COVID-19 and over 5,395 deaths since the start of the pandemic. Our hospitalization rates have ranged from 49% in April of 2020 to present day numbers where we were currently running at a 91% capacity. And who is disproportionately affected by COVID? The CDC reports that the Black population tests positive at an average rate of 13.8%, followed closely by Hispanics at 11.9%, Asians at 7.2%, and whites at an even 7%. Among laboratory confirmed COVID-19 associated hospitalized cases, American Indian and Alaskan Natives, Blacks, and Hispanic people have higher hospitalization rates compared to Asians and white people. Data on race and ethnicity for more than 90% of people who died from COVID-19 reveal that the percent of Hispanic, Black, and American Indian or Alaskan Native people who have died from COVID-19 is higher than the percent of these racial and ethnic groups among the total US population. So we've talked about health, communication, transportation, and housing. What other sectors or areas of focus do you all think should be prioritized in an equity plan for Tarrant County? And if y'all will take just a moment to add your thoughts to the chat or unmute yourselves and speak. Monroe, criminal justice, absolutely, I'm right there with you. Lynetta, education, yes ma'am, yes ma'am. Kind of touching on some of these other social determinants of health are really important. Employment opportunities and access from Merville, thank you, thank you. Healthcare, health services for undocumented, absolutely. People that are often overlooked, forgotten, or even intentionally left out of our systems of care. Access to care, yes, yes. How, if we have the care available, how do we encourage people to access it? How do we make it possible for them to access it? Removing those barriers. Linda, yes, holding people pre-trial at the county jail for low-level offenses. Cite and release doesn't work if their arresting officers don't use it. Cultural competent care, definitely. Untreated mental health issues that are the cause of many criminal cases. All important things to address and all things that we want to incorporate into our planning. Maggie just popped in with stigma. Yes. Stigma can be associated with many of these things. Stigma can be associated with mental health issues. Stigma can be associated with your socioeconomic status, with whether or not maybe you've been recently released and you're trying to re-enter the population and get housing or get employment, you know, get those things. Harrison, the backlog in the legal system, absolutely, absolutely. All things that we can take a look at. Thank you guys. Lynetta, child protective services and youth services, definitely. And y'all feel free to keep going, considering how to impact change within all sectors through the lens of older adults. Yes, we can't forget that either. These demographics are important. We're not just here to focus on race ethnicity. We're here to focus on all of these different demographics that affect the way that people live, work, play, worship, do those things in our community. Charles, ageism, definitely, definitely something that we all want to look at and address through this planning. So we've got a little roadmap here. We've already talked about how we're going to build on the success of others, and we've touched a little bit about the local planning efforts that are happening around us. So the next things that we're going to look at are going to be how we're going to develop and implement this plan, incorporating stakeholder feedback, and then ending with our goal, which is a roadmap for our future that hopefully we can add to these other successes that have come before us, and maybe another community or another organization in the future will be using our plan as a roadmap for their planning. So we definitely want to focus on data-driven decision making. We want to invite discussion with subject matter experts as we move along this path. And we want to prioritize the stakeholder feedback. So we're going to do that by looking at data through recent community needs assessment efforts. And we're also going to be surveying the community. We're going to be holding listening sessions and town hall style forums at different steps along the way so that we can make sure that we're getting that stakeholder feedback. I came from working with the population of people that live with HIV, and they had a saying. They said, "Nothing for us without us." And I feel like that translates really well to the work that we're going to be doing here. We can't plan for our community without our community being involved. So stakeholder feedback is going to be a really important piece. So as we develop this plan, I think that it's important that we keep a few things in mind and that we incorporate into the introductory period of our plan, whatever our final product looks like. I think that we want to touch on a little bit of the history of Tarrant County. And some of it is not so nice, but that's reality. And I think that we need to be very real and very intentional as we develop this plan. So we're going to touch on some of those racial injustices. We're going to talk about our history of redlining and segregation and gentrification and access to healthcare. And then we can also take a look at where we are today. What is Tarrant County in 2022? How much progress has been made from our history and how much is still left to go? Then we can talk about our mission and our purpose. We know that we're going to be creating a plan together to allow us to move forward, better prepared for the next crisis, so that we can improve things day to day in the lives of our residents of Tarrant County. But we'll also be asking you guys in future meetings to really flesh that out, to really decide what your purpose is going to be with this plan moving forward, beyond just advancing racial and health equity. We also want to talk a little bit about our health equity specialists. They are going to be facilitating our subcommittee meetings. So in addition to this big, large group that we've put together, we'll have focused small meetings that are going to look closely at data and planning for communication, housing, transportation, health, and then we're also going to get more feedback from you guys on some of those other areas of focus that you all were just mentioning: criminal justice, education, so that we can figure out exactly what we're going to address in this plan. So our health equity specialists will facilitate those small groups, and they will also be there to assist your organizations, particularly those with limited resources, with identifying your policies and practices that are in need of development or change and helping you do those things. And then also identifying needs for staff or client training needs. And your subcommittee sector work, you're going to look at that focus data, you're going to engage in some really deep discussion, and through that work, you're going to come up with these short, medium, and long-term goals and strategies so that we can move forward into implementing this planning. Our last step will be evaluating. So we'll look at the progress that has been made on short and medium term goals and strategies, and we'll evaluate whether or not it was successful. Those evaluation methods will be built into our planning, so we'll know what to measure whenever we're looking at those changes. And our goal is going to be long-term sustainability and accountability. So we don't just want to do this and then finish and say, okay, we're done. We want to make sure that these changes that we're putting in place are going to be here long after our work getting it set up is complete. And we want to make sure that we stay accountable to completing this work, especially with the long-term planning. We need to develop ways so that we can continue to check back in and make sure that it's progressing and make sure that it's still happening and that we're still working towards achieving those long-term goals. We'll end up with a final report, a product that can be shared, a product that others in Tarrant County and beyond can use as a roadmap for their own local governments or for their organizations so that they can follow what we have done to implement changes on their levels. Another question, how? How do we hold each other accountable in this work to create equitable change? Like, what kinds of things can we do to keep each other accountable to our goals? Thanks, Shelley. I see you there. Frequent communication. Charles, timetables. Lynetta, ask questions. Share our wins. Offer support to our colleagues. I love that, Lynetta. Yes, I think it's so important that whenever we're talking about heavy subjects like this, and Maggie pointed out earlier that the doom and gloom is important, and it absolutely is, but it's also important when we are able to make these changes and we do have successes. It's a good thing and it should be celebrated as a win, should be celebrated when we make progress. Maggie, creating something actionable versus a plan that sits on a shelf. So a commitment to action. Yes, yes, yes. When we were putting this group together, I had the privilege of speaking with a gentleman, and he was kind of asking me what we were doing and why he should be involved. Why should he set aside time to join us in this work? And so we had that conversation, and at the end, he asked me why I personally was being involved in this work, and what was I doing? Why was I here? And I told him that it's important to me to contribute however I can to change things. I was raised in a very small town, typical white rural racist family. And I've worked hard to overcome where I came from and to be more self-aware and to look for ways that I can give back. And myself and the health equity specialists, my team, we pursued these positions and we interviewed and sought these positions knowing that this is short-term work, that once this grant period ends in 2023, we're not guaranteed to have jobs. But it was important to all of us. We're personally vested in making this happen. The appeal to me, as I hope is the appeal to you all, is that this isn't just creating a plan. This is implementation and evaluation. This isn't going to sit on a shelf. I can promise you that, Maggie. It's work that will actually happen. It's work that at the end of this period of time, we'll be able to look back and say, we did this, we made changes. We made changes that are going to contribute to better outcomes for the people around us and improve our community. And that's a huge thing for me, and I hope that it's a huge thing for all of you as well. Brenda, clear and measurable goals, report progress, lack of progress, which is also important. We all know that this isn't going to go smoothly. That's an unrealistic expectation. We're going to hit road bumps. Sharing about those barriers, we have many people here that are already doing this work. We have organizations that have whole departments and divisions that are related to diversity, equity, inclusion. So that's why you were invited. We need to hear from you. What works? What doesn't work? What have been those challenges that you guys have faced in your work, and how have you overcome them, so that we can help these organizations that need that assistance, that don't necessarily have the money or the manpower to do it themselves. How do we do that? How do we help them? That's why you all are here. Monroe, to avoid the temptation to split from the outline goals. Right, that's that accountability. That's that accountability piece, you know? Let's not let it fall by the wayside. Let's keep moving it forward. Let's hold each other accountable to this work. Harrison, engagement from all civic levels. Absolutely, absolutely. That has to be built in. Ensure that strategies developed include input and feedback from highest levels of systems and organizations involved. That was from Merville Johnson. I agree with you, Merville. Just as important as it is that we have buy-in from the communities that we serve, we also need buy-in from those folks that are in leadership positions, or else this isn't going to work. Winnie, developing solid and sustainable partnerships utilizing SMART goals. Yes, ma'am. Yes, ma'am. Yes, SMART goals, Charles Harper said. Alfonso, building relationships with partners in the community to include ones that have not yet been at the table. Definitely, definitely, Alfonso. And I would like to touch back on what I said in the beginning. Who's here and who isn't? And if you know somebody that you feel like should be here, if you know of a neighborhood organization, if you know of a grassroots, you know, little small organization that's out here trying to do work that needs a platform, needs a voice, needs to be at our table, please, 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 please reach out and let me know. We'll be happy to invite them in. We definitely want a whole community effort here as much as possible. Pat, a dashboard on key performance indicators by specific goals and objectives that is shared frequently. Tactics may change, but the targets should remain the same. I love that. I love that. You know, the acknowledging that we may have to shift a little bit. We may have to fine tune our efforts, but that our goals, our targets should remain the same. We don't want these moving targets. We want to say, this is what we're going to do. We may have to tweak how we do it, but this is what we're doing. And Charles Harper, maintaining transparency to foster trust in the process. Yes, again, accountability. We want to be accountable to each other. We want to be accountable to the people that we serve. I love that. I love that. Patricia, thank you, Lauren, for your commitment and passion. No, ma'am, thank you. Thank you for being here. I am so grateful and privileged and honored to support you all as we do this work. I am just as excited as all of you to be here. I think it's going to be challenging, and I think it's going to be all consuming, but I am so happy to be doing this and so happy to be a part of it. So thank you. Yes. While progress is good, it is not the goal. I agree. Continuous. We want this to be continuous. And I'm going to hand this over now to Dr. Wingate, and she's going to touch on some final thoughts and get us closed out. So Dr. Wingate, if you're ready.
I am ready. Let's go ahead and move to the next slide, please. So call to action. First, I just want to say thank you again for everyone for being here. I mean, the chat has been on fire, and it has been wonderful to hear your thoughts. We are capturing everything so that we can make sure that we're all staying focused on the work. So one of the things, as you can see, that there are a couple of things that we have listed here on your call to action. We want to make sure that you are incorporating that health equity in all policies, programs, services, and budgets. We know that sometimes when we are receiving money and funds, and sometimes we just continue to put money in things that don't necessarily need to have that amount of money. And so maybe we need to do an analysis and say, where is a better place that we can put some of those funding in order to maybe to be able to reach those individuals that we are serving so that we can improve their quality of life. We want to make sure that we are contributing to those inclusive, equitable solutions. Equitable, we just have to focus on that piece, that we are meeting people where we are. It goes back to that previous slide that Lauren had that talked about how there are those that get exceedingly more and those that get exceedingly less. But if we can just make sure that we are being intentional in the efforts and the work that we are doing to make sure that we are reaching and including those who we are serving in this process, so we can come up with solutions that will be sustainable over time. And we do, again, have to be able to develop and expand those objectives, those strategies, these goals to dismantle individual, systemic, and structural racism across organizations and throughout our community. That is key to the work that we are doing here in advancing racial equity with this council. And then again, lastly, as you can see, shift your thinking. I think as we move through this process, each one of us are going to have some aha moments that we are personally going to make some changes. We're going to professionally make some changes. We're all going to grow, and we're also going to grow our staff, our teams, and those who are serving in the process. So I just want to say that let's keep these in mind at the forefront as we're moving and doing this work. And it just goes back to what Donna was saying, that it's not just about the progress. We want to be about doing good work. We want to be about doing work that we know is going to impact lives for generations to come. All right, thank you. Next slide, please. So what are the next steps here? You are here in this session. You're here to learn more about what this council is going to be about. And so we are going to be able to be sending you some discussion prompts for our meeting that'll be coming up in March. So the goal is to be able to have monthly meetings with the overall larger group. And then of course, we will have subcommittees that will be doing the work. And so we will be looking at and asking each of you to identify where you want to do the work, if you want to be in the larger group, if you want to be one of the worker bees, if you have staff that you can lend to the process to do some of that work, that's important as well. And so you'll have that opportunity, and we will keep you abreast of what all is going on, whether or not you're able to be seated here physically. We still know that your voice is important. So if you can say something because you know it's going to be impactful to the work, that is exactly what we are looking for. You will have engagement with the health equity specialist, as Lauren mentioned before. We are looking forward to identifying those organizations for whom we can share our staff with them, and they can be and work with that organization for about 2 days out of the week. But we'll also make them available to everyone else to be able to do some of that extra research. Again, it is imperative that everyone finds where they fit in best so that they can be engaged in this work. This is important work. This is good work. This is meaningful work. We are about to change lives as we expand on much of what is going on here so that we can make sure that we are being better prepared for another public health emergency. It's coming, and we want to make sure that we're in the best place possible to serve the people and meet their needs. So the next meeting is slated for March. The date and the time in March will be determined. We will send out a poll so that we can make sure that we are getting most of the people who want to come to those meetings, and we can be able to convene. And I am looking forward. I am excited. This team is ready to do the work. They're hungry. They're passionate. And so just as each of you are here, so we are grateful to have you. We look forward to being in this partnership with you, building stronger, trustworthy relationships across this community, because remember, we are all in this together. And so I'm really excited about that. So I'm going to go ahead and I'm going to turn it back to Lauren so that we can, again, continue to wrap up this meeting. Thank you once again.
Thank you, Dr. Wingate. And now actually I'm going to turn it over to you guys. Does anyone have any questions If we know the answers, we'll give them to you, and if we don't, we'll find out. So.
Thank you very much. This is Pat Bailey with P. Bailey Enterprises. This has been awesome to be a part of this discussion. And so I want to really say to everyone, I appreciate the opportunity to speak to one particular point. It is very, very complicated when you have these many disparities to begin to weight its overall importance across the various lanes that you've identified. Do you have a prevailing scorecard of success, not just from the earlier report that you shared, but as it relates to Tarrant County, so that we get a sense of where the weight and the emphasis should be placed first? And my concern is this: a lot of the disparities bring about a more long-standing issue. Some are more costly to execute. How are you weighting which and where to step first accordingly?
That is a great question. So the sectors that were identified through the research and the work that they did when they were preparing for the opportunity, the things that we initially started with, which were communication, health, transportation, and communication. And housing. Those were already pre-identified as needing priority by a community needs assessment that was done, and by local data that they had been collecting throughout the pandemic. Other than that, when we opened it up to ask you all what sort of things that you had seen and what sort of things you had experienced and what areas of focus that you think should also be priority, those things will be up to you all to determine. So we'll provide data. We'll provide data on each of those different areas of focus. And what we will ask you to do, while we support you in the work, of course, is to look at that data and make those decisions about what you would like to prioritize in addition to those pre-identified areas of focus.
Thank you.
Yes, ma'am. I had a request to go ahead and take down slides, thinking that that might be might make it easier to facilitate a little bit of this question and answer. So I wanted to give you guys my contact information right quick. Of course, I think I've sent most of you emails, and I will definitely be following up with each of you with more emails. So if you don't have it right now, I will follow up with you early next week about this meeting that we just had, and I will make sure that you have it then. But per request, I'm going to go ahead and stop sharing my screen now, if that's okay. All right. How about anybody else? Does anybody else have any questions? I feel like if you don't have questions, then that means that perhaps we did a good job presenting our intentions to you all.
Are there any comments that anyone would like to make?
I'm just curious, how long do you anticipate this group meeting? Are you thinking over a year, or, and maybe I missed that in the presentation, but great presentation, by the way.
Oh, thank you very much. Yes, the time frames are pretty hard and fast. So we will meet all the way through May of 2023. That does not necessarily mean that we will meet every month. I think that it's important that we meet as often as necessary during the development phase of the plan while we're getting everything laid out with our goals and our strategies and where we want to address change. But once we actually start with implementation, and then after that, the evaluation phase, it may be that you all think that we don't need to meet every month, that we could meet every other month as needed to kind of check in and touch base and where are we at. Obviously, our equity specialists will be out in the community working closely with your organizations. So we'll have our hands, our fingers out there in the work. We can distribute updates and information via a newsletter, via email. Dr. Wingate touched on it lightly, but I just also want to reiterate that we know that you all are busy. Again, we were very intentional when we reached out to you and asked you to be a part of this work, because we know that you're motivated and that you're decision makers and that you are very important people in our community. And so we want to be mindful of that. We want to be mindful of your time and your effort. And we want to provide a variety of ways for you to provide feedback. You know, it may be that you can't possibly add another meeting to your schedule every month, but maybe you can add a meeting every other month or every couple of months, but you still want to have your voice in this work. Okay, we're going to make it easier for you to do that. We're going to make sure that we keep you guys informed with regular meeting summaries. When a meeting happens, if you miss one, you'll be able to read through those notes and see what's happening. We will provide an easy, user-friendly form, an online link where you can click it, and it'll have some pre-filled in prompts where you can provide the information or the guidance or your thoughts, your ideas, your expertise if you're not able to be present at a meeting. So we want to make it as easy as possible for you all to participate. And I think that a lot of the determination about when you will meet, how often you will meet, will really be up to you all as a group to determine what is and is not needed.
I have
All right.
something I'd like to point out, put it in the chat too. We were talking earlier on about the need for built environment and local policy and other things that are part of helping to address equity. But yet currently our local governments, the decision makers, the policy makers are frequently the mayor and the council. And in most of our municipalities, those jobs are basically limited to no compensation. On the bond, on the election coming up on May 7th, Fort Worth is proposing and asking the voters whether they will approve pay increase for the mayor and council members that would actually put those salaries at a livable level, which would enable people who are regular people in the community to run for and get, you know, and potentially serve in those positions. So because this is a election that's at an odd time, it typically has a very low voter turnout, but it would be nice if somebody could be on the city council, or who could be the mayor, who isn't independently wealthy, who maybe come from a community experiencing inequities, and be able to be a voice for that community in the decisions that are made.
Hear, hear. Hear, hear. Thank you, Linda.
Excuse me, can you all hear me?
Yes,
Lauren?
ma'am. Yes, ma'am.
Hi, this is Christina Brooks. I just in reference to the comment, as the Chief Equity Officer for the City of Fort Worth, that the policy recommendations for equity come out of our department, and it is not an elected office, and we are funded and staffed with about 20 people working on these issues. We also have the Human Relations Commission, an elected body from the community that is currently working on the race and culture initiatives across criminal justice, economic development, education, governance, health, housing, and transportation. In all of these topics that were covered in the presentation today. So I can appreciate your comment, but I just wanted to make it clear especially to the individuals that are working on this project and on this call, that Fort Worth does have an established department specifically devoted to these issues, and that's why I am representing the city in this capacity today.
And we appreciate you being here, Christina. Thank you so much for those comments.
All right, if there's no further questions or discussion, then I think I'm prepared to give you all some of your time back this morning. I just want to close out by thanking you all again. I'm excited to work with you guys and hear what y'all have to say and what your plan is going to look like. And I will talk with you again soon. Have a great day.